So my name is Edel Cashman and I'm from Cork. When I was 9 years old I was diagnosed with liver disease. So I just was told at the time that it was going to be kind of a thing for life and I just have to manage it with medication. So it was a lot to take at the time and I suppose I didn't really understand it fully, but I just kind of had to live with it. Got through first year and then it was when I started second year, everything was really good at the start. I was having the time of my life. And then I just got really sick all of a sudden. Literally over the weekend I just felt like I had a flu or something, and a really bad kind of pain in my abdomen, and went into hospital and it was just all kind of a blur from there. I don't really remember a lot, but I was in ICU in Cork and then I had to transfer to Dublin to Vincent's there, and I had after that spent about kind of 3 weeks in hospital, and I was assessed for a transplant and just kind of told there and then that I would need a transplant. So that was a huge shock because I went from being really well and literally going out every night, going to coppers, everything like everyone else, and then just suddenly I didn't know whether I'd be able to go back to college. I didn't know if I'd be in hospital for months. I just didn't know anything. So I was placed on the transplant list for a liver in December 2016, and then I thought I'd get the call sooner than I did. So I was like the summer before second year I was waiting, and then I did second year, I was still waiting. Summer after second year I was still waiting, so then I was kind of saying, okay, what do I do now? Do I go back to college again? Even though I was getting sicker all of the time, I was getting more tired, the kind of symptoms were worse. I had a lot of kind of fluid build up in my legs, which was really hard to manage, especially being the age I was in 1920s. You want to go out and you want to look nice and wear skinny jeans, and I couldn't really do that. But eventually I decided I would try go back to college in third year. But then quickly decided that I just couldn't. I just didn't have enough energy. So I decided to defer that, and then a few weeks after I decided to defer it, I got the call for the transplant, and that was in October 2018, just last October. I was well compared to a lot of people waiting for a transplant. I was actually able to go to college. It wasn't exactly normal, but I was able to. There are a lot of people waiting, and they're waiting in hospital because they're so sick, and they're obviously going to get a transplant quicker than I am because they're closer to death, for want of putting it bluntly. But if there were more people who donated organs, then they would be transplanted, but so would I, and then it wouldn't be hard for me as well. I literally spent my time waiting, wishing myself to get sick, because I knew if I got sick I'd get a transplant, and I wouldn't have to be waiting. So you're kind of stuck, and the doctors were kind of saying, oh no, you need to be well to go into the operation, because the better you are going in, you make a better recovery. So I was there trying to keep myself well, but then they were saying, oh, but you're actually too well, so you're not a priority, so it's like, what do you do? Whereas if there's more people or donating their organs, then there are more transplants. So for a lot of people, it's not they don't want to donate their organs, it's that they just have never thought about it before, and they've never talked about it with their family. So when it comes to the decision, their family are saying, well, we don't know if our loved one wants to donate their organs, so they say, well, better err on the side of caution and not, which, it could be the complete wrong decision. It might be not what the person didn't want at all, Yeah, just have the conversation, have that chat. This bill will help, but you still need to have that chat with your loved one.